Hello, everyone, and welcome back to the podcast. If you want to quit your job, but you're worried about what you would do for health insurance, this is the episode for you. Today, I'm chatting with Dr. Noor Ali, a doctor, surgeon, and health insurance advisor who's passionate about helping creative freelancers and entrepreneurs figure out their health insurance. With open enrollment coming up soon, now is the time for you to find your best fit health insurance plan to support you on your entrepreneurial journey. I know health insurance is such a pain point for so many of you, so I can't wait to dive into this conversation. Noor, welcome to the podcast.
Thank you, Lindsay. Thank you so much. I'm so excited because, like you, in my experience, I get this often, like all the
Mhm.
time. Is entrepreneurs really afraid to make the leap into their passion project, their side hustle, really just afraid to leave their corporate roles because of health insurance? So
Yeah.
I can't wait to offer like nuggets of wisdom today.
I'm so excited. Okay, so before we dive into all the good stuff, I'd love to know a little bit more about what inspired you to become a health insurance advisor. And in particular, why do you love working with freelancers and entrepreneurs?
Yeah, thank you. I don't think I did not seek out this career at all.
Yeah.
It's definitely something that I fell into. I think it was a career that's born out of failure. My story really starts when I'm 5 years old. I'm sitting on my grandfather's lap and we're reading our favorite book together. It's actually Gray's Anatomy, the number one anatomy
Oh,
textbook
wow.
for medical students worldwide. I look up at him, I've got hearts in my eyes, and he looks down at me and says, "Hey, you're going to be a doctor just like me someday, aren't you?" Yes, Dada, I am. So from there, my journey has really been on a fast track towards medicine, like since I was a little girl. So in middle school, I'm taking high school courses. In high school, I'm taking accelerated college courses. When
Mm.
I'm 18 years old, like about to start my journey and starting college, I get this phone call, and I'm living in the Big Apple with my family in New York City. Dada's died. My grandfather passed.
Oh,
And my
wow.
father looks at us and says, "Hey, we all have to move back to Bangladesh now." So all of a sudden, I find myself standing in the middle of my all women's medical college campus. I'm clutching my very own Grey's Anatomy textbook this time, and I'm standing in 118 degrees sweltering heat, and I'm tripping over chickens and goats. Dada, where are you? What is this life? In New York City, I would have been eating these chickens off a halal chicken and rice cart. So at that time in my life, Lindsay, I was really, really struggling just to survive. I couldn't eat the food. I was too skinny. I couldn't communicate with my peers because of language and communication barriers. So, what really gave me comfort was my education. So, I dived
Wow.
in deep. In my free time, I developed this internationally award winning community project serving free antenatal care to slum dwelling women all over Bangladesh. And my work was awarded by
Wow.
Nations in 2014. One of my professors recognizes my ambition and he says, "Wow, you're really good at surgery. You just timed 16 minutes and 50 seconds for the C section. No one's ever done that before." So even though I was struggling kind of to survive, I was really thriving in my professional medical and surgical career.
Hmm.
So I'm at my final year of medical school, about to graduate, and love is like the last thing on my mind. But a man that I met 6 years earlier in back in New York City, he finds me halfway across the globe, and he wants to go on a date. So he flies to Bangladesh, and he asks my father if we can, get together, go on a date. Uh, sure, if you marry her. Okay, can I have some time to think about it? Yeah, I'll give you 15 minutes. So that conversation happened on a Wednesday, and we were married by Friday evening.
Oh my
So
God.
that road showed up really quickly, but I took it and I never went back. So now we're in this long distance relationship, right? I'm in medical school, finishing up. He's a professional working in New York City. So 2 years go by and we're in this long distance marriage. And finally, I'm done with my training and it's time for me to go back to the United States to be with my husband. Now, I was a superstar surgeon in Bangladesh, right? Like just crushing it. But back in America, I have to pass my United States medical licensing exam. So I don't have to go
Mhm.
through medical school again, but I have to pass this licensing exam. I'm on paper, I'm like this awesome doctor, right? excuse me, in experience, I'm like this awesome clinical experience. But on paper, I just look like a high school graduate because I skipped
Yeah.
undergrad and I went to straight to a foreign medical school. So I'm mopping floors at a Subway restaurant. This is my Subway sandwich shop, my first job
Yeah.
back in the States. And all I can think about is this exam, right? It's like this enormous fire breathing dragon, and I just can't get over it. So I give the test, I get my test results back, and it's not what I expected. I missed it by one question. So
No.
now what am I going to do? You know? So we decide to move down to Florida. I'm 26 years old. I'm living with my in laws in sunny Florida. And I'm trying out all of these different career options, and nothing seems to make me feel worthy. Like nothing seems right until this opportunity for health insurance. And I'm like, health insurance? What is this? They never taught this in medical school. I studied and trained in a country where there is no systemized insurance system, right? It's all
Yeah.
pay per service. So if you're rich and you have money,
Mm.
you have healthcare. If you don't, then you're dying. I get basically that was healthcare in
Yeah.
Bangladesh. So then I'm handed in my second week of training, I'm handed this medical underwriting guide, and I'm like, what's this? Amy next to me, she's like Googling and stumbling over words like cholecystectomy. And I'm like, it's cholecystectomy, resection of the gallbladder, indicated in chronic cholelithiasis in some cases of chronic cholecystitis. And I am fluent in this language and I am like
Mm.
crushing it. So that's when I knew really that my road just merged into my path. And I have been able to use my clinical background and education and really apply it to my years of experience in public health and health insurance to really advocate for the consumer and like drastically improve the customer experience journey. So that's
Yeah.
how I led to what I do now. And what I really do now is advise female entrepreneurs. I love working with the female population. Anyone who's considering or at any point in this entrepreneurial journey, I help advise them on how to leverage their position utilizing the healthcare system that we have to really win when it comes to health insurance. So, a very long
Mm.
winded response to your question, Lindsay, but I hope you like
No.
my story.
What a story. That was so good. I love that you shared all of that. And like we said, I know health insurance is the number one thing that holds people back from really getting started in their business or going into freelancing. So, first of all, what would you like to say to the listeners who are feeling stuck right now in their job because they feel like their health insurance options are limited and they have to rely on their employer?
Yeah, the first thing I want to say is that's just not true. You absolutely do not have to rely on your employer. There's tons and tons of options out there. And where you go and where you research, now that may be confusing. And that's where I think working with a professional like myself, a health insurance advisor, it costs absolutely nothing, can help kind of guide your research and figure out what's out there for you. But employer sponsored coverage is absolutely not the only option for you.
I know something else that may be a misconception that people have is that they may know that they have options outside of their employer, but they think or assume that it's going to be much more expensive to get health insurance on their own. So, what have you seen in terms of the cost for health insurance, getting it through an employer versus getting it on your own?
That's a fantastic question, Lindsay. Now, typically, if you work for a huge corporation, then most likely you're probably getting a great deal because your employer is offering 50 to 95% off of that already subsidized premium. So, the word I want you guys to think about when you think of insurance is risk, right? So, the bigger the pool, the bigger the group, whether that's a corporation or a small business or your team size, that's going to dilute that risk and then, of course, affect your premiums according to that. So yeah, if you're part of this huge corporation, then you probably do have great insurance benefits that you're not going to be able to match. But if you work for a small and medium-sized company, what I've seen in the past 2 years with the trends with inflation and healthcare and the economy, there's actually private market options are actually even less in premium than your employer sponsored options and sometimes even better coverage. So it's not always cut and dry. And I think it's always very important to do that research before making that decision and opting in to your employer sponsored coverage when it comes time for open enrollment.
Yeah, that's such a good point. I mean, in my experience, my premiums have been very low, especially, the first few years of your business where you may not be making much money. There are, what's it called? The premium tax credit that can cover
Mhm,
some of your
mhm.
premiums, which is as far as I know, but I'd love for you
Yes.
to share a little bit more. So let's dive into what are the options that people have outside of getting a traditional health plan from their employer?
Fantastic. Yeah, let's jump right in. That was a beautiful segue. So,
Yeah.
what your options are and what you choose really depends on what stage of your business you're at, like you said. So, when it's time for us to shop for health insurance outside of employer sponsored coverage, so assuming you're the 51% of America who doesn't have an employer offering benefits, there's really two spaces for you to go shop for that plan. And these are two worlds that hardly ever touch. So, we've got the public healthcare marketplace and we've got the private healthcare marketplace. The public healthcare marketplace, also known as ACA, politicized as Obamacare. Now, health insurance, even though the public ACA is federally sponsored, healthcare costs and health insurance is actually governed by state law. So each state kind of has their own version of the marketplace. And where you live has everything to do with what plans and what companies are part of that marketplace and what benefits are offered to you. So my suggestion is if you're just starting out in your entrepreneurial journey and you can qualify for a lower income, more specifically less than 400% below the federal poverty level, which is roughly 50K. So if you're making 50K or less, the public marketplace is a great place to start and look for your health insurance because you're going to get a subsidized plan, those premium tax credits that you're talking about, where the government is going to sponsor you and pay a portion of that premiums because of that lower income. And then after that, what happens? That obviously you're in business to grow, and as you experience that growth, my suggestion is as soon as you cross that subsidy qualifying threshold, as soon as your business makes more than 50K in revenue and you're growing, pull out of the private marketplace and now consider a plan on the private market because that's where you're going
Mm.
to get a better deal because no now the government's not sponsoring you or giving you any tax credits. You're not you're paying full price for a plan. You're going to do a lot better shopping for it on the private market. And there's tons and options there.
Okay, that makes a lot of sense. That's really good advice. So, what about for people who are, still in their job right now, but they are thinking about leaving and so they want to get an understanding of what their health insurance cost would be? Are you able to like apply and kind of maybe use an estimated income or, for someone who hasn't necessarily started their business yet or made much money in their business, can they still look into what their health insurance options would be after they left their job?
Yeah, totally. And great websites to kind of play around with those numbers is healthcare.gov, which is the government website,
Mhm.
but that's not very user friendly and it can get really it's just not pretty. So I love the website healthsherpa.com. So that's a
Okay.
version of the public healthcare marketplace in your state and it's super user friendly. So you can put in the filters like, yeah, I just lost my job or benefits and pretend like you're in that situation and play around
Mm.
with different income levels and see what your plan premiums prices would be at those growth and income levels.
Okay, that's really good to know. I'll link Health Sherpa in the show notes for you guys.
Mhm.
And what about people who have maybe a chronic health condition or any type of condition? I know that's a big concern that a lot of people have is, yes, maybe if you're young and you're healthy and you don't have dependents, you can get a cheap public health plan. But are there still good options that are available for people who either do have dependents, maybe they have kids that they also have to cover, or they have some type of chronic health issues and they really do need a really solid healthcare plan?
Yeah, totally. I'll talk a little bit about my specialization now, Lindsay, and tie this in. So what I
Mhm.
do is my space is really in the private market under a medically underwritten health insurance plans. So this is a type of a plan where instead of using your income as a primary determining factor for calculating your premiums, we're going to use your health as the factor. Now, we want to leverage our situation and, of course, make those changes as it adjusts. If we have a lower income, we want to take advantage of those subsidies. We're going to get a public plan. But once we no longer qualify for that tax credit, now I propose using your health as the qualifier, right? So the younger and healthier you are, the lower risk you appear to certain health insurance companies who are willing to bet on that risk and offer much better benefits at a fraction of the cost. Now, to answer your question about those chronic conditions or families, it really just depends. And that's where you have to have a consultation with an advisor. Just have a conversation with a professional to figure out where you stand. For example, if you're an asthmatic who just has an inhaler here and there, versus if you're an asthmatic plus an obese smoker who gets frequent hospitalizations and nebulizations, completely different risk categories, right? So really just have to figure out where it is you stand, what your needs are for health insurance, and where can we get those needs met and covered at the lowest cost for you. And that's some of the work I do with that strategy, is help you figure that out.
Yeah, that's such good advice. And it's nice to know that there are advisors out there. I think a lot of people don't realize that there are literally people whose job is to help you with this and help you figure
Yes.
out what your options are, because it can be so overwhelming. And I think a lot of people just assume, oh, it's going to be expensive. I'm not going to be able to afford it. And so they never really look into what their options are. And I always say, you're never going to know until you look into it and just see, because you might be surprised at, how inexpensive a plan might be. Or at least if you know how much it's going to cost, then you can start planning for it, right? And budgeting for it and setting those goals of, okay, I really want to be making this much in my business before I leave my job, or whatever that looks like for you. But I just can't stress enough. Please don't stay in a job you hate just because of health insurance.
Yes. Oh my gosh. Yes. Can we both scream that? Like
Oh
record
no.
ourselves screaming that? Like, don't do it. But Lindsay, it's not, I also think like we've crossed the other side. Like we're here
I
now
know.
talking about
Yeah.
it. But for someone who's going through it, like they don't even think, like think to be like, oh
No.
my gosh, like let me give this example. I recently heard your podcast on another show,
Yeah.
and I learned a little bit about your family and your background. For your parents, let's say, who are used to having that same role for decades, maybe they never even thought to see how much are my benefits costing? Can I
Yeah.
adjust my compensation or something like that? So when you're used to something happening, and I get this a lot on my consultations when people come to me for quotes, the first thing I'm going to ask is, how much are you paying right now? Because if I don't know that, how am I going to know if I'm putting you in a better or a worse position? And many
Hmm.
people who are in corporate roles, they don't even know how much is coming out of their paychecks, right? For that
Yeah.
healthcare or health coverage. So that is at the very least the minimum. Even if you're not thinking about quitting your job, just find out and know how much your healthcare is costing you, how much is coming out of your paychecks, and what are your benefits. Once we
Yeah.
have that data, then I can offer, a strategy or a plan. But that is baseline data that we all really just need to know, what, regardless of what career decision you make.
That's such a good point too, because I never knew. I couldn't tell you how much I was paying for my health insurance when I had an employer. Like I just
Yeah, yeah.
picked my plan and assumed that it was a reasonable benefit and like premium, and I never paid attention to it. So you could actually be paying more than what you need to be paying under your employer, and just not even realize it.
Exactly, exactly, and that's happening more now as we see some economic trends, because healthcare costs are rising and
Yeah.
employers are trying to minimize their bottom lines. So it might just make more sense, even if you have an employer, to go for
Mm.
an individual plan.
Yeah. Okay. So I know the open enrollment period is coming up for this year, 2022, if you're listening to this when it comes out. So can you talk a little bit about what that means and what are the steps that people should be taking during this time?
Great question. So I want to first define what is open enrollment and what is this buzz around it, right? So open enrollment simply means it's a period of time where you can elect to renew your current health insurance plan or opt out or pick something different. Now, open enrollment for the company that you work for might be wildly different than the open enrollment. So what is the open enrollment? That's what that refers to, is the public marketplace. Because it's guaranteed issue, anyone and everyone can get a plan. You really only have November and December to decide what health plan you're going to pick, and you're pretty much stuck with that for the following year. A caveat there, though, you can cancel any health insurance plan at any time. However, I will suggest having something in place before you go making those drastic changes, because of specifically the open enrollment windows. Now, open enrollment really only refers to the public marketplace, because in the private market, plans are sold all year round. Like I work January to December all year, but
Mm.
it's just the time of the year where it's on everyone's minds to make an evaluation. So my suggestion is, really don't wait for the rush, because that's when everyone's like, oh shit, I got to figure this out, before the new year. And
Yeah.
it's like holiday season and no one wants to talk about health insurance. You barely know anything about it. So it just adds to kind of all the negative energy related to health insurance. So I would say don't wait until late. Take some time to evaluate how much you're paying, what your coverage is like, can you do better in terms of premium or coverage? And really, some of the assessment points that I advise is evaluate in the past year, did you meet your deductible? If not, then you're probably can
Mm,
qualify for a health-based plan because you are just a low usage or you don't use health insurance enough. Also think about, do I have any surgeries or big things coming up? If yes, what is the health insurance plan that I can use to cover that at lowest out of pocket for me? And do that evaluation constantly, guys. Like I talk about this for women who are expecting a baby. Your husband doesn't need to be on this awesome maternity plan. You can use that
yeah.
and take advantage of that and have him on something else until your needs for baby are met, and then make those adjustments. So this is a constantly revolving door where you should be analyzing and evaluating your needs and making health insurance and healthcare decisions based on those needs.
That's such a good point. I mean, I know that open enrollment is coming up, and I do have a public plan right now. So I will definitely be evaluating it and looking at, how much did I actually use it this past year? And there might be other options that are even better for me now. And whether you're on a public plan, a private plan through your employer, looking at how much you're spending, because it's so easy, especially when you're in a job and, it's coming out of your paycheck before you even see it. You might not be realizing how much you're spending on benefits that you're not even using.
Yeah, yeah, for sure. Definitely evaluate
Yeah.
and make that before you kind of jump in and make a rush decision like, okay, I'll just renew what I have just because it is. And one of the most common things I see in young people, Lindsay, is this notion, and this has been kind of drilled into our heads from capitalism and big insurance, which is
Mhm.
that, oh, I'm healthy, I hardly ever go to the doctor, so give me the highest deductible you have with the lowest premium. I want to talk a little bit about premiums and deductibles because I see this fallacy play out in young people all the time. And I think this is like the influence of capitalism and big insurance trying to convince you that, hey, I'm healthy, I hardly ever use my insurance. And that automatically translates to I should have a higher deductible and a
Mm,
lower premium and pay as little as out of pocket as I can. So I want you to think about this scenario again, bringing risk back into the game, right? So premium is what you're paying per month for just having your policy, right? So this is the price of your policy that you have to pay whether you use it or not. Deductible is the amount of money that you have to pay in addition to the premium before the insurance will step in and cover for your medical expenses. So as a healthy person who hardly ever uses their insurance, you're paying that premium per month no matter what. If something does happen to you, the chances of that are very, very low because you're young, because you're healthy. You hardly use insurance. But if that does, what's happening? Now you have to spend maybe five, six, seven, $10,000 out of your own money in deductibles before insurance is going to give any benefits towards your accident or big catastrophic event. So who
mhm.
paid? Did the insurance pay or did you pay? You just
Yeah.
insured that you're going to pay, not them, in the very little chance that something does happen to you. So my advice there is really find a cost balance for what is a comfortable premium for you with the lowest deductible possible. So in the
Mm.
small likelihood something happens, you're not paying more money out of pocket. Your insurance company is.
Yeah, that's such a good point because I specifically remember I think getting that advice of just choose the high deductible plan because you're young and you're healthy and the chances are so low of something, major happening. But like that's the point of having health insurance is that accidents happen, like things happen, and you don't want to get stuck with that bill, right? So,
And
that's
all of that
such
is true, Lindsay, like you said, like
yeah.
all of that are facts, but the part that you should have a high deductible plan, that's the fallacy. Like you need a
Yeah.
lower deductible plan because of those reasons.
Yeah. Okay. So good. I hope everyone listening is taking notes. um, and I also wanted to ask you, I know you mentioned Health Sherpa, and I'm sure
Yeah.
people already went on that website. So outside of that, what are some steps that people should take if they're in that phase where they're considering either taking their business full time or just quitting their job and maybe they don't know what they would do next, but they're like, I need to get out of this job.
Yeah. Definitely find a professional that you like and just talk to them. One of the things I have to caution people is when you go online, kind of searching for health insurance for yourself, what happens is when you put your information out there for quotes in the health insurance industry, in the home and auto, in the insurance industry as a whole, you can't just ever get a number online. Someone
Hmm.
has to a licensed professional who is certified in that state that you're searching in has to draw up that quote for you. So
Yeah.
thinking that you can DIY this research your whole way, you're just going to get really, really frustrated and it's going to be a rabbit hole that you don't want to go down. So I would say really just find a professional and work with them and communicate with them where you are, what your needs are. One of the questions, Lindsay, that I guess asked a lot is like, what is the best health insurance plan? And this is
Hmm.
how I like to answer. The best health insurance plan is the one that's going to cover what you need it to cover. You're
Yeah.
going to be happy when you use your health insurance and you pay nothing or you get like a minimal bill and you're like, oh, that was awesome. My insurance covered it. Now,
Hmm.
that's different for different people, right? And I'll bring the maternity example back because that's
Yeah.
common. So, someone who has a great plan that covers everything but maternity and they're trying to have a baby on that plan, they're going to be very, very frustrated and say, well, this insurance sucks. So it's really
Hmm.
a conversation about what are you looking from, what do you want from your health insurance? What do you want it to cover? And once we know that, then I'm going to be like, all right, let's find you that plan. Let's find you the plan that covers that so you can be happy.
Yeah. Okay. I have another question for you then. So if you're on a public health plan, to my understanding, you can only make changes to your plan. Is it during the open enrollment periods or if you have some sort of event in your life, right? A
So yeah,
qualifying event.
you can so two different questions there. You can sign
Okay.
up for a public marketplace plan only during open enrollment or a life
Okay.
qualifying event such as moved, had a baby, got married, lost coverage, lost job. That's when you can sign up. You
Mm,
can make changes or you can cancel your plan anytime, but I would caution you to have something in place before you cancel because then you have to wait until next open enrollment in case something falls through because those are the only sign
yeah.
up times.
Okay, got it. So let's say um I find out that I'm pregnant, right?
Mhm.
I could go in and search for a different plan that covers, maternity and things like that at any point.
So pregnancy is not one of the life qualifying events, unfortunately.
Interesting.
Yeah. So if you're
Okay.
planning to, and that's I'm so unpredictable. Like, how do you know? Like, what if you
Hmm.
get pregnant? So for those of you who are planning, I would say pick a plan during an open enrollment that's going to cover that maternity really well. Some things to look out for
Okay.
is what is the maternity deductible? What is the max out of pocket? Can I afford that in the worst case situation? But if it's an unplanned pregnancy, it really depends on what time of the year you find out. And if you're in a period of open enrollment, awesome. If not,
Mhm.
we've just got to research what's out there in the private market for you to cover that
Okay.
pregnancy.
And then I don't know if you already said this, but what actually is the open enrollment period for public health insurance?
Sure. It's November 1st to December 15th.
Okay.
Most years, most states extend that to December 31st or January 15th, but traditionally it's November 1st to December 15th every year.
Okay. So good. And the other question that I have is, so if you are a business owner, um, are the health plans that are available to you only for you as an individual, or are there plans that are like, because obviously as an employer, you have the option of providing your employees with health insurance. So is there an option for you to get insurance through your business almost like as an employee, like if you're set up as an S corp or something?
Yeah, totally. Your questions are so good, Lindsay. I have to thank you for like all of these
That's
amazing
because these
questions.
are legit the questions that I have as a business owner. I'm like,
I love it.
let me just
I love
ask.
it. So let's talk about small business health insurance. If
Yeah.
you are a business owner with a team or employees under 50, you technically don't have to, you legally don't have to offer them benefits, right? But if
Yeah.
you're a solopreneur, just like yourself, you can have your health insurance premiums deducted from your business checking account and write them off as health insurance premium expenses during tax season. I'm not giving tax advice. I can't, but that's what my clients do as a business expense. So that's the way to do that. Now, If we're talking for more bigger teams, there's really a lot of flexibility when you're a solopreneur or under 50, because you legally don't have to offer your team health insurance. There's so much creative things that we could do. You can have you can say, hey, I'm not ready to offer health insurance just yet, but here, let me connect you with someone and you can figure it out on your own. Or, hey,
Hmm.
I'd love to offer 50%. That's all I can do right now. Or here's just $50 towards your health insurance plan. You figure out what's right for you, and I can offer this stipend or credit towards it. So lots of
Okay.
creative ways to go about that.
Okay. So how can people work with you or, find, by the way, do you work all throughout the US or is there a specific state that you're in?
Yeah, I'm licensed to consult in 34 states and
Okay.
counting. The only other states I don't work in is because I'm just not available yet, but I'd love to. So 34 states across the US. I work with anyone in those
Yeah.
states.
Okay. So how can the listeners work with you if they want to work with you specifically or find an insurance advisor in their state?
Sure. Yeah. Working with me is super easy. So if you go to my website, drnoorhealth.com, DRNOORHEALTH.com, I offer free consultations, free 15 consultations all across the US, where I really offer like strategy, like what we talked about today. So
Hmm.
here we're going to talk about what's going on, what you need, what you like, don't like. And on that call, I'm going to offer you what all of your options are with quote ranges for you to plan and budget. If you're ready to like, hey, I need health insurance, I want to work with you, awesome. Next step is we go through your plan, make sure that you love it, and we sign you up if it's a good fit. So
Hmm.
all consultations are 100% free. If we decide to work together, I have a very simple structure, which is a one-time $100 fee to work with me, or $12 a month for 12 months. And with that, you have my concierge services for the life of your policy.
Wow. Do you work in Massachusetts?
I'm not licensed in
Oh
Massachusetts, but we should
no.
still, I know, but we should still talk, Lindsay. I don't know. I'll figure something out. I always do.
Listen, let me know once you're licensed in
Yeah.
Massachusetts.
Yep.
But I will definitely leave that link in the show notes for anyone. And do you know what is the best way for someone like me who you're not licensed in my state to find a health insurance advisor that I could work with?
Yeah, totally. I would first start with, where are you shopping? Is it the public market or the private market?
Mm,
If it's the public market, start with Health Sherpa. It's beautiful, user friendly. It's a self-enroll platform, so you
okay.
can DIY it, which is awesome. In the private market, I still think you should talk to me so we can get a gauge of like where we need to go, and then I can connect you to industry resources. Or
Mm,
it's just so hard to Google and DIY. So unless you know someone, what you're going to see when you Google, Lindsay, is really what the biggest companies with the biggest ad dollars have, what they really want you to see. So
yeah.
in my industry, just because of how it's structured, I don't recommend, DIYing without having a personal referral or a recommendation for a resource.
Okay. Got it. Thank you so much. I have one final question for you, but before we get to that, I'd love for you to let the listeners know where they can find you if they wanted to connect with you on social media, or anywhere else. And also if
Yes.
you have any resources that you want to share.
Yeah, I have a guide that I'd love to share with your
Mhm.
people. It's called "The 6 Terms You Must Know When Shopping for Health Insurance," and in it has questions that you should be asking when you're considering or evaluating your health insurance plan or considering switching. So I'd love to share that with you guys. And
Mhm.
on social media, I'm super active on LinkedIn and Instagram. I'm always on my stories. You can catch me doing cute things with my son and my family. So I'd love to see you on my Instagram, and of course connect with you on LinkedIn.
Yes, I love your Instagram. Your reels
Thank
that you
you.
make are so much fun to watch.
Thank you.
Did you
They're
say that
hard,
that
man.
guide
They're hard.
I know. Did you say that guide was on your website?
It's about to be on my website, and I can
Okay.
share it with you, Lindsay, if you want to link
Yeah.
it in the show notes for people to pick up. Yeah.
Okay, I definitely will. So before we wrap up, Nora, I'd love to hear from you. What is your biggest piece of advice for the woman listening who's feeling stuck in her job and wants to work for herself, but she's hesitant about making that leap?
Yeah, I would say that anything that you think is holding you back, there's a solution for it. It's just you finding and connecting with that and being resourceful to really seek it out. So if you want to quit your job because whatever's holding you back, there's a solution for it.
I love it so much. Thank you again for coming on and for sharing all of this. I have been dying to have an episode about health insurance because I know it keeps so many people stuck. And I'm just so excited that now I'll be able to have a resource for people so they don't have to stay stuck in their job because of health insurance.
Yes, 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 yes.